Botulinum toxin, also known as Dysport Vial, is used to treat a variety of medical conditions. It can help with eye disorders such as crossed eyes and uncontrolled blinking, muscle stiffness or spasms, and movement disorders. Additionally, it can be used to reduce the appearance of wrinkles and prevent frequent migraines. This medication works by relaxing muscles and blocking the release of a chemical called acetylcholine. For those suffering from overactive bladder, Dysport Vial can help reduce leaking of urine, the feeling of needing to urinate right away, and frequent trips to the bathroom. It can also be used to treat severe underarm sweating and excess saliva by blocking the chemicals that activate the sweat and salivary glands. It's important to note that Dysport Vial is not a cure, and symptoms may gradually return as the medication wears off. If you are considering using Dysport Vial, it's important to consult with your doctor to determine the correct product and dosage for your specific needs. Before starting to use Dysport Vial, make sure to read the medication guide and patient information leaflet provided by your pharmacist. This medication is administered by injection into the affected muscles by a healthcare professional. It is used to treat eye disorders, muscle stiffness/spasms, wrinkles, migraines, excessive sweating, drooling/excess saliva, and overactive bladder. The dose, number of injections, injection site, and frequency will be determined by your condition and response to therapy, and for children, the dose is based on weight. Most people start to see an effect within a few days to 2 weeks, and the effect usually lasts 3 to 6 months. Side effects of Dysport Vial may include redness, bruising, infection, and pain at the injection site. Other side effects may include dizziness, difficulty swallowing, respiratory infections, pain, nausea, headache, muscle weakness, double vision, drooping or swollen eyelid, eye irritation, dry eyes, tearing, reduced blinking, increased sensitivity to light, headache, neck pain, drooping eyelid, non-underarm sweating, fever, anxiety, urinary tract infections, burning/painful urination, or difficulty urinating. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. If you experience any symptoms of a serious allergic reaction, seek medical help immediately. And if you notice any other effects not listed here, contact your doctor or pharmacist. After injection, Dysport Vial can spread to other parts of the body, possibly causing serious side effects, which can occur hours or even weeks later. However, the chances of experiencing these serious side effects when using this medication for migraines or skin conditions such as wrinkles, eye spasm, or excessive sweating are very low. Children being treated for muscle stiffness/spasms are at the greatest risk of these effects, as well as anyone with certain medical conditions. It is important to discuss the risks and benefits of this medication with your doctor. If you experience any of these very serious side effects, seek medical help immediately: chest pain, difficulty breathing, excessive muscle weakness, irregular heartbeat, severe difficulty swallowing or speaking, or loss of bladder control. Before using Dysport Vial, make sure to inform your doctor about any allergies you may have and any other medications you are taking. It is also important to discuss your medical history, especially if you have any bleeding problems, eye surgery, heart disease, or muscle/nerve disorders. Dysport Vial may cause muscle weakness, droopy eyelids, or blurred vision, so it's important to avoid activities that require alertness or clear vision until you know how this medication affects you. It's also important to limit alcoholic beverages while taking Dysport Vial. If you are using any other medications, including prescription drugs, non-prescription drugs, or herbal products, be sure to inform your doctor before having surgery. Older adults and children may be more sensitive to the side effects of Dysport Vial, so it's important to discuss the risks and benefits with your doctor before use. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Dysport Vial with your doctor before starting the medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Dysport Vial include certain antibiotics, anticoagulants, Alzheimer's disease drugs, myasthenia gravis drugs, and quinidine. Be sure to discuss any concerns with your doctor to ensure the safe and effective use of Dysport Vial. If someone has taken too much Dysport and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. An antitoxin is available, but it needs to be administered before symptoms of overdose appear. These symptoms may include severe muscle weakness, breathing difficulties, and paralysis. If you have any concerns about a potential overdose, don't hesitate to seek help right away. Before using Dysport, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Dysport is used to temporarily improve the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults younger than 65 years of age. Dysport is used to treat cervical dystonia, severe spasms in the neck muscles. It is also used to treat muscle spasms, stiffness, in the upper limbs, elbows, wrists, fingers, or lower limbs, ankles, toes, in adults and children who are at least 2 years old. The Dysport Vial is used to treat the abnormal head position and neck pain associated with cervical dystonia. It is also used to improve the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults younger than 65 years of age for a short period of time, temporary. Dysport Vial is also used to temporarily lessen the appearance of facial wrinkles. You will receive Dysport Vial in a hospital or clinic, and you will not need to store it at home. This medication is used to treat cervical dystonia, muscle spasms, and certain cosmetic issues. Your healthcare provider will determine the appropriate dosage and the best time for you to receive this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.